So, what if the most powerful medicine a doctor could prescribe wasn't actually a pill, but just a dose of humanity? In this explainer, we're going to dive into the work of a thinker who believed exactly that, and whose ideas, honestly, are more important now than they have ever been.
Have you ever sat in a doctor's office and just had that feeling that you weren't really there? Like the doctor was treating a lab result, a number on a chart, but not you? It's a feeling a lot of us have had, and it really points to a genuine crisis in modern medicine. And that feeling, that sense of being reduced to just a piece of data, that's not an accident. It's a symptom of what one absolutely brilliant thinker called a crisis of dehumanization in care. A crisis he saw coming long before the rest of us even had a clue. That thinker was Edmund D. Pellegrino. And look, this guy wasn't some academic just thinking deep thoughts in an ivory tower. No, he was right there on the front lines. He was a physician, a top bioethicist, even a university president. He saw with his own two eyes how medicine was becoming this incredible technical marvel, but was kind of losing its soul along the way.
So, what was Pellegrino's big solution? Well, he argued we need to go back to the very basics and ask a really simple question. What is medicine actually for? I mean, what is its ultimate purpose?
To do this, he reached back for an ancient Greek concept, telos. Telos just means the ultimate purpose or aim of something. So for a knife, its telos is to cut. For a seed, it's to become a tree. So Pellegrino asked, okay, what is the telos of medicine? And his answer was, it's not just curing diseases. That's part of it for sure, but it is not the ultimate goal. For Pellegrino, this was the absolute bottom line. Every single prescription, every diagnosis, every interaction, it isn't just a technical procedure. It's a moral act. It's a moment where one human being is being entrusted with the well-being of another person who is vulnerable and in need.
Okay, so if the ultimate purpose, the telos, isn't just curing, then what is it? What should a doctor actually be trying to do here?
The ultimate aim, Pellegrino said, is to achieve the patient's good. Now, this is a concept you might hear called beneficence in ethics class, but for him, this good was this really rich, multi-layered idea that went way, way beyond what any blood test could possibly show you. He saw this good as having 4 distinct layers. Of course, you start with the medical good. You got to fix the biological problem. But then you have to ask about the personal good. What does this patient, this human being, actually value in their life? Beyond that is the human good. Am I treating this person with dignity? And finally, there's the spiritual good, respecting their search for meaning through this whole ordeal. A truly great doctor, Pellegrino argued, has to be working on all 4 of these levels. Now, to actually do this, to serve the patient's total good, a doctor has to understand a really critical difference, the one between the objective medical problem and the very, very human experience of having that problem. Pellegrino called this the difference between disease and illness. The disease is what's on the chart, diabetes mellitus type 2. It's objective. It's a fact. But the illness, that's the human reality. It's the fear of losing your eyesight, the frustration of totally changing your diet, the way it disrupts your entire life. See, patients don't walk into a clinic because of a disease. They show up because of an illness. And a doctor who only treats the chart completely misses the whole reason the patient is there in the first place.
This, as you can imagine, puts a ton of responsibility on the doctor. It's not just about what they know, it's about who they are.
Pellegrino used another Greek term here, arete. Arete basically means excellence or virtue. It's that special quality that allows something to fulfill its purpose, its telos. The arete of a knife is its sharpness. So what's the arete of a doctor? It's not just about technical skill. It's the whole set of virtues you need to truly achieve the patient's good in all its different dimensions. So what does this excellence, this arete, actually look like? Pellegrino laid out what he saw as the essential virtues, not just compassion, but prudence, the wisdom to choose the right path for this specific person, not just blindly following a protocol. Honesty, to tell the truth with real care. Humility, the courage to just say, I don't know. And maybe above all, fidelity, this fierce, unwavering loyalty to the patient's good, no matter what, no matter the pressure from hospital administrators or insurance companies. For Pellegrino, these aren't just soft skills. They are the core of medical excellence. So why does this philosopher from the 20th century matter so much to us, right here, right now?
It's because the very things he warned us about, they're our reality now. He saw the dangers of the commercialization of medicine decades ago. He was afraid that profit motives would slowly chip away at a doctor's loyalty to their patient. And his solution? Integrating the humanities, philosophy, art, literature into medical school to teach empathy and make sure doctors could actually see the person behind the disease. I mean, these are the exact debates shaping the future of healthcare today.
And his work leaves us with a huge, critical question for our own time. As AI gets better and better at diagnosing the disease from scans and data, who's going to be left to care for the illness? In a world full of algorithms, who is ultimately responsible for the patient's good? Technology can't answer that. We have to.